This medication, Tramadol Hcl, is used to help relieve moderate to moderately severe pain. It belongs to a class of drugs known as opioid analgesics and works in the brain to change how your body feels and responds to pain. It may be taken with or without food. The dosage is based on your medical condition and response to treatment. To reduce the risk of side effects, your doctor may start you at a low dose and gradually increase your dose. The best time to take this medication is when you first notice pain. Always follow your doctor's instructions for the best results. Before you start taking Tramadol, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually up to every 4 to 6 hours as needed for pain relief. You may take this drug with or without food. If you have nausea, it may help to take this drug with food. If you are using the liquid form of this medication, be sure to carefully measure the dose using a special measuring device/spoon. The dosage is based on your medical condition and response to treatment. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. The maximum recommended dose is 400 mg per day. If you are older than 75 years, the maximum recommended dose is 300 mg per day. Pain medications work best if they are used as the first signs of pain occur. If you have ongoing pain, your doctor may direct you to also take long-acting opioid medications. In that case, this medication might be used for sudden, breakthrough, pain only as needed. Other pain relievers may also be prescribed. Suddenly stopping this medication may cause withdrawal, especially if you have used it for a long time or in high doses. When this medication is used for a long time, it may not work as well. Though it helps many people, this medication may sometimes cause addiction. Ask your doctor or pharmacist for more details. Tell your doctor if your pain does not get better or if it gets worse. If you experience nausea, vomiting, constipation, lightheadedness, dizziness, drowsiness, or headache, they may decrease over time. Make sure to consult your doctor or pharmacist if these effects persist or worsen. To prevent constipation, make sure to consume enough dietary fiber, drink sufficient water, and engage in regular exercise. You may also need to take a laxative, so it's best to ask your pharmacist for the appropriate type. To minimize the risk of dizziness and lightheadedness, make sure to rise slowly when getting up from a sitting or lying position. It's important to remember that your doctor prescribed this medication because the benefits outweigh the potential side effects. However, if you experience serious side effects such as interrupted breathing during sleep, mental or mood changes, severe stomach or abdominal pain, difficulty urinating, or signs of adrenal gland issues, make sure to seek immediate medical attention. Additionally, seek help immediately if you experience fast or irregular heartbeat, severe dizziness, fainting, seizures, or symptoms of serotonin syndrome/toxicity. This includes fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe nausea, vomiting, diarrhea, twitching muscles, unexplained fever, unusual agitation, or restlessness. Furthermore, Tramadol is converted into a potent opioid drug in the body, increasing the risk of serious side effects in some individuals. Seek medical help if you notice slow or shallow breathing, severe drowsiness, difficulty waking up, or confusion. Lastly, although rare, seek immediate medical help if you experience symptoms of a serious allergic reaction, such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. Remember that this is not an exhaustive list of possible side effects, and it's important to consult your doctor or pharmacist if you experience any other effects not mentioned. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Tramadol has the potential for abuse and addiction, and may cause severe breathing problems, especially when starting the medication or after a dose increase. It's important to take the smallest effective dose for the shortest possible time to lower your risk. Avoid taking Tramadol with alcohol or other drugs that can cause drowsiness or breathing problems, as it may lead to serious side effects, including death. If you are prescribed Tramadol, discuss with your doctor or pharmacist about having naloxone available to treat opioid overdose, and make sure your family members are aware of the signs of an overdose and how to treat it. Keep tramadol in a safe place to prevent theft, misuse, or abuse. For women of childbearing age, it's important to talk to your doctor about the risks and benefits of using tramadol. If you are pregnant or planning to become pregnant, using tramadol may slightly increase the risk of birth defects, especially if used during the first 2 months of pregnancy. Using tramadol for a long time or in high doses near the expected delivery date may harm the unborn baby. Babies born to mothers who use tramadol for a long time may also develop severe withdrawal symptoms. Children younger than 12 years old should not use products containing tramadol. For children between 12 and 18 years old, tramadol use after certain surgeries is not recommended, especially for those who are obese or have breathing problems. Some children may be more sensitive to tramadol and may experience serious breathing problems. It's important to discuss the risks and benefits of tramadol with your doctor or pharmacist. Are you allergic to tramadol or any of the inactive ingredients in the medication? Before taking tramadol, make sure to check in with your doctor or pharmacist if you have any allergies. Tramadol may affect those with certain medical conditions, including brain disorders, breathing problems, kidney or liver disease, diabetes, mental/mood disorders, substance use disorder, stomach/intestinal problems, difficulty urinating, gallbladder or pancreatic disease, or obesity. Be cautious when using tramadol, as it may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. Avoid driving or using machinery until you know how tramadol affects you and avoid alcohol while taking it. Tramadol may also affect your heart rhythm, causing serious symptoms such as fast/irregular heartbeat or severe dizziness that need immediate medical attention. This risk may be increased if you have certain medical conditions or are taking other drugs that can affect heart rhythm. If you use liquid tramadol products, be aware that they may contain sugar and/or aspartame, and use caution if you have diabetes or phenylketonuria. Before having surgery, inform your doctor or dentist of all the medications you are taking, including tramadol. Be mindful that some children and older adults may be more sensitive to serious side effects of tramadol, such as extreme sleepiness, confusion, or slow/shallow breathing. If you are pregnant, discuss with your doctor whether the benefits of taking tramadol outweigh the risks to the unborn baby. And if you are breastfeeding, be aware that tramadol passes into breast milk and may have negative effects on the nursing infant, so consult your doctor before breastfeeding while using this medication. Drug interactions can change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Tramadol Hcl include certain pain medications, naltrexone, and samidorphan. Taking MAO inhibitors with this medication may cause a serious and possibly fatal drug interaction. The risk of serotonin syndrome/toxicity may increase if you are also taking other drugs that increase serotonin, such as certain antidepressants, street drugs, or St. John's wort. Other medications can affect the removal of tramadol from your body, which may affect how tramadol works. The risk of serious side effects may be increased if this medication is taken with other products that may also cause drowsiness or breathing problems, such as opioid pain relievers, alcohol, or muscle relaxants. It's important to check the labels on all your medicines and ask your pharmacist about using those products safely. This medication may also interfere with certain lab tests, so make sure your lab personnel and doctors are aware that you are using Tramadol Hcl. If someone has taken too much Tramadol Hcl and is experiencing serious symptoms like passing out or having trouble breathing, it is important to give them naloxone if available and then call 911. If the person is awake and has no symptoms, it is crucial to call a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of overdose may include slow breathing, slow or irregular heartbeat, coma, and seizure. It is important to seek medical help immediately if any of these symptoms occur. It's important to remember not to share your prescribed Tramadol Hcl with anyone else, as it is against the law. This medication has been specifically prescribed for your current condition, so it's essential not to use it for any other condition unless your doctor instructs you to do so. In that case, a different medication may be necessary. Tramadol Hcl is used to help relieve moderate to moderately severe pain. It belongs to a class of drugs known as opioid agonists. It works in the brain to change how your body feels and responds to pain. Take this medication by mouth as directed by your doctor, usually every 4 to 6 hours as needed for pain relief. You may take this drug with or without food. If you have nausea, it may help to take this drug with food. Ask your doctor or pharmacist about other ways to decrease nausea, such as lying down for 1 to 2 hours with as little head movement as possible. Make sure to store Tramadol Hcl at room temperature, away from light and moisture. It's important to keep all medications out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. When the medication is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.